My name is Patricia White and I'm a project officer with the EAPC, which is the European Association for Palliative Care. We play a pivotal role in dissemination in a wide range of EU-funded projects. And what this involves is the knowledge transfer and exchange of research findings to our stakeholders. When we talk about stakeholders, particularly in the terms of the EU-PAL COPD project, we're really talking about three different groups. The first group is the researchers, the scientists, the healthcare professionals who work both in palliative care and in respiratory. The second group are the patients and the family members. And the third group are the policymakers. So the work that we do in Work Package 9 on outreach is about communication and dissemination with these stakeholders. And what's important is about building a network of stakeholders from early on. Early engagement is essential, just as early palliative care is essential. Early engagement with stakeholders is very important. It means that when we are towards the end of the EU-PAL COPD project and we have our exciting results to share, people already know about the project and are eager to learn about the results. We're very lucky in Work Package 9. We have a very comprehensive group of partners working together. We have the ERS, Lungs Europe, Accelerant and EAPC. And this group of partners working together is ensuring that the messages in terms of the EU-PAL COPD project and the key messages about the early and timely use of palliative care for people with COPD, that these messages are reaching the people who need to hear them. So that they're reaching the palliative care community, the respiratory community, but most importantly, with the work of Lungs Europe, they're reaching the patients and their families. And also then that the patients can work with us in terms of developing materials and giving us feedback on how we're doing with communication. Within this work package, we need to ensure that we're getting the message across about effective and timely palliative care. One of the ways that we can do this is with the EAPC Congress. We have a dedicated EU project session, and this is a time for members from different EU projects can come together, can meet and can share their ideas, their challenges, but also some of their solutions in terms of working on large, multifaceted and international EU projects in palliative care. And most importantly then, towards the end of the project, we will be developing policy recommendations. So we will be working together on the results from the randomized controlled trial and the health economics analysis, and we will be using these results so that we can have evidence-based policy recommendations. And it is these policy recommendations that we hope can be developed, and that this will help change the lives of those living with COPD.